Hello, good morning, good afternoon, and good evening, everyone, and welcome to this International Pharmaceutical Federation, or FIP, webinar, which is a joint effort from the COVID Expert Advisory Group and the Academic Pharmacy section. The focus of our webinar today is to discuss how COVID-19 has impacted the way we deliver high-quality pharmaceutical education now and in future pandemics. My name is Anisha Sandhu, and I will be one of your moderators, and I'll also be speaker two for this webinar. I'm a registered pharmacist, both in Australia and New Zealand, and I joined the world of academia in 2018 as an assistant lecturer in Monash, Malaysia. I'm an active member of the FIP, and I carry out several roles through the organization, and I'm also a member of the Strategic Task Force for the Malaysian Association of Education for Medical and Health Sciences. I have a strong interest in education design, delivery, and research, and I've been awarded several commendations in education excellence. I'd like now to hand the platform over to my co-moderator, Desa, to introduce herself.
Thank you, Anissa. Thank you. Hi, everyone. Good morning, good afternoon, good evening, wherever you are. My name is Desa Enawati. I'm a pharmacist as well as a lecturer at the Faculty of Medicine, Budayana University in Bali, Indonesia. I'm also Global Lead BG4 at the FIP, and I'm also the coordinator for Advanced Pharmacy in Indonesian Pharmacists Association. Next, please. Well, a little bit of briefing and announcement for this webinar. This webinar is being recorded and live streamed via YouTube, and this recording will be available on our website at www.events.fip.org. If you have any question, you can use the chat box and the question box provided. And if you would like to provide any feedback, please send to webinar@fip.org. And to become a member of FIP, please click the following link. Next, please. So, as mentioned by Anissa earlier, the learning objectives of today's event, and we will aim to deliver the following learning objectives. So the first one, we will describe how pharmaceutical education has changed over the COVID-19 pandemics. And we will also explain how different nations have coordinated pharmaceutical education during the pandemic. And there will be our speakers will also discuss about list of enablers and barriers to deliver innovative and high quality education during the pandemic, and discuss approaches needed to be taken in future academic to ensure pharmaceutical education outcomes are delivered very well across the country. Next, please. So in today's event, I introduced ourselves as the moderator. We have Anissa Sadu as well as myself. And then there will be 4 topics as mentioned earlier. So the first topic on how has the COVID experience in advanced pharmacy education will be delivered by Anissa Sadu as well as Son Gleason. And the topic on enablers and barriers to deliver innovative and high quality education will be delivered by Ali Daring Anderson. And Sabat Melaba will also discuss about how to prepare the future pandemics, which is an approach for pharmaceutical education from the African perspective. And we will also listen from the quiet perspective from Dalal Outwell. And lastly, we will have the summary and conclusion. Next, please. So let's start with the first one. How has the COVID experience advanced pharmacy education? And we would like to introduce our first speaker, Sound Ellen Gleason from the MGS, and she's currently the Associate Dean for Distant Degrees and Programs. She is Associate Professor of Clinical Pharmacy from the University of Colorado School of Pharmacy in the US, and she's the Global Lead for DG1 on academic capacity on the FIP Hub, and she's also the COVID-19 Expert Advisory Group in Education. So please, the time is yours, Song, to discuss about COVID experience.
All right. Thank you so much, Desak. It's my pleasure to be here today. to share with you a little bit about how COVID has changed our pharmacy education experience. And what we thought we would do to get everything started is to provide a brief literature review that will serve as a foundation for the information that we'll be hearing from my colleagues today. Now, I'll tell you, my literature review skills are pretty basic. So my search terms were basically COVID and pharmacy education, and a whole lot came up. I tried to limit it to within the last 1 to 2 years. And then there are some areas where I chose articles that that provided a great deal of references or contributed a little bit to the concept. And as I read through the literature, I found that there were really 3 main themes that came to be. And those were the concepts of sharing, caring, and then I had to have another rhyming word. And so that was preparing. So I'll talk about those 3 concepts, sharing, caring, and preparing, as I review the literature. So the first one is the concept of sharing. Something that came about in response to the COVID-19 epidemic was how we work together. Not for the first time, but really much more so than ever before. We really reached out to each other as individual academicians and as well as institutions. So we reached out to help address how do we provide this education so quickly, and importantly, how do we support our students through all that? And our ability and the outcomes from working together were just really quite amazing. One of the concepts that came about from this, that there are a lot of calls to continue, is the idea of sharing learning content. It was a way that we could make this change rapidly, and moving forward, things to advance our education is it will help us maybe reduce some faculty workload moving forward. It might contribute to more of a global pharmacy curriculum, and it helps us with the concept of sustainable pharmacy education. And there was a great article by Lyons et al. that kind of get to this concept of sustainability, reducing, reusing, and renewing our learning content. And you know, the other part about this is this can maybe kind of catapult us to some other methods of education, such as competency-based education, by renewing and putting some of our content online. But the concept of sharing learning content is being called for quite a bit to stay with us. And then, like I said, ways to work together was covered quite a bit in the literature. So next slide, please. With the next slide, the other concept that came out in the literature, and I think we can all attest to in practice, was the concept of sharing. Terms that came up quite a bit were well-being and grace, along with kindness, empathy, and dignity, and others. And of course, this was something that really helped us support our students, and I think we all did a fabulous job of it. And it was something that was so needed during the COVID epidemic. But as we move forward, it's just such a nice way of working with our students and supporting them. So there are calls to, you know what, let's continue to have an eye toward wellness and well-being, caring, and grace as we move forward. One of the concepts that came about in the literature for the remote and online education is that while the students certainly appreciated it, there are some studies now coming out that, you know what, they do fare better psychologically with still some face-to-face and live interaction. So as we continue to embrace some of these remote and online concepts, it is always important to still have some of this live interaction, whether it's synchronous on a teleconference platform like this, or of course in the live setting. And then the other concept that came about is we were so good about supporting our students and reporting on that. The group that was a little underrepresented in the literature was the effect on the faculty and administrators. And so it's my good friend and now boss, Tina Brock, talks about how we all learn on airplanes to put your mask on first before you help others. Well, that's something we need to take into consideration as we prepare our education. Let's think about ourselves. So there are calls for us to really focus on the effects of our faculty and administrators. Along with that, we need to provide more continuing professional development in all of the methods that we used. Next slide, please. And then when I get to preparing, how did we prepare our education? As we all know, we made the rapid pivot quickly to remote and online education. And so there's a ton in the literature about that. By no means could I include them all, but I will direct you toward the article there by Courtney. It was a scoping review that has almost 100 citations there. And the other thing they did was they summed it up nicely in 4 main categories of lab-based or practice education, experiential courses, and didactic courses, as well as well-being. And so you'll find lots of good review of what we did there and what we should keep and so on. If we look at the lab-based practice concept, we were able to make the rapid pivot toward remote and online OSCEs, practice with communication, simulation, all of that. And as we move forward and we're able to be back in the classroom, we might start to think, well, maybe we don't need that so much anymore. But what we learned from experiential education is that telemedicine, it came about more so in COVID-19, but it's here to stay with us. So that those classes where we were able to provide that simulated practice might serve as good ways to provide practice for telemedicine. So I would ask, and it's in the literature, that maybe we need to continue a little bit of that to help provide a foundation for our students for telemedicine practice as well. Concepts that came up in our didactic courses was the importance of flexibility that we were able to have with remote and online education. So that's important to keep in there. Some self-directed learning that with the remote and online, it provides a foundation for that continuous professional development and self-directed learning that is so called for. And that kind of gets us to the next step to competency-based education. It could maybe direct us there. Some concerns that did come about is a lot of us turned to remote proctoring, and that served us very well. But as more and more of it was used, there were some equity concerns that came about. So that's something to keep an eye on. And also some considerations of, does that direct us toward the best way of assessing our students? It leads to a very knowledge-based type of assessment. At least as far as I can tell. I'm sure there's more out there that I'm not aware of, but those were some of the concerns that were raised about remote proctoring. And next slide, please. And so then the other concept that was so important and is being called for moving forward is to, first of all, recognize that, you know what, everyone, we did it. We were able to make that rapid change. We were creative. We banded together. And so there are calls for us to be mindful that as we approach future challenges, that we have this experience and we know we can make changes rapidly when we need it. So let's continue to embrace that, that great spirit that we successfully did during this time. Things that are still needed is a continued focus on learning outcomes as we do these new methods of education. A lot of the literature focused on student perceptions and what they, basically what they thought of it. So now it's time to get to the learning outcomes, especially in the experiential setting. There are calls to continue the focus on student well-being and also to continue that focus on faculty and administrator well-being. Some other concepts that came about were important infrastructure concerns that we need to continue to keep our eye on to help us prepare for the next emergency or really just in general. And that largely focused on internet provision as well as some infection control aspects that can allow us to be face-to-face. So I hope this brief summary will show you that what we're going to be hearing about this morning from my friends and colleagues in their shared experiences are supported in the literature. So with that, I will turn it over to my friend, Dr. Allie Daring-Anderson. Oh, I'm sorry. I turn it over to Anisha.
Thanks very much, Sean.
Yeah.
Thank you. That was some brilliant insight there. And I'll actually use my time here to actually build on some of the points that Sean actually made. So what I found was that there were 3 sort of emerging themes in the post-pandemic pharmacy education space. And these are all points that are centered largely from a Malaysian and a Monash University perspective on how the COVID experience has actually advanced pharmacy education. So firstly, what I found was there was more of a focus, and as Sean has rightfully mentioned, on mental health and well-being, keeping workforce readiness in mind. And secondly, there's a large level of openness to push for the boundaries really of exploring the medium of online and remote learning a little bit more, and even from a collaborative context, in fact. And thirdly, the pandemic also brought with it a big focus on exploring creative uses of the online medium to enrich student experiences. And I'll touch a little bit more on that shortly. So in terms of mental health and well-being, I think it's no surprise that COVID-19 really highlighted the importance of mental health and well-being, particularly for our health workforce, and with it a realization that we actually need to provide adequate training on coping strategies to ensure workforce readiness of our pharmacy graduates. There's so many things that are actually impacting our students these days. Firstly, the fact that they're actually transitioning from high school over to the university, which is already in itself a very big step that they have to make. And then transitioning from physical learning to online learning to hybrid learning. On top of that, they're dealing with their normal academic stress, the normal social pressures that they may have, and also needing to learn a whole bunch of new things, which are technology related as well. So they're already facing a lot of pressure and a lot of stress. And so what we've come to find now is that within the pharmacy world itself, with many schools introducing and rolling out new curriculums or updating their curriculums, they are also taking the lead from, I believe, the Global Competency Framework for Education, or the GCFE by the FIP, where there is an emphasis now on teaching more about professional skills and transferable skills. They're starting to realize the importance of, getting students to understand about teamwork, about negotiation, conflict resolution, problem solving. And on top of that, they've also realized the importance of equipping students with resilience coping strategies so that they're able to deal with the added pressures that they're most likely going to have when they go out into the workforce. And so what we've come to find is that, many curriculums are now looking into introducing things like resilience workshops. In fact, some universities such as Monash were even looking into creating a dedicated curriculum for resilience as well. And all of this is to really bring about more open communication and discussions so that students understand that when they go into the workforce, it's okay for them to actually have conversations about their well-being, have conversations about mental health, and to introduce concepts to them such as burnout so that they're aware of it, and mindfulness as well so that they also understand ways that they can deal with all the difficulties that they're likely to face once they go out into the workforce. I'll take this time now to highlight, for example, an initiative by Monash, which is the Monash Parkville International and Exchange Students, or we call it PIES, the Monash PIES. So Monash PIES really came about when, in addition to thinking about the stresses that students are currently facing or have faced while they were undergoing the COVID-19 pandemic, with a focus on the additional impact that international students must have faced as well. International students, in addition to all the other pressures faced normally by students, would have also had issues with potentially having language barriers, having cultural differences, potentially going through things like financial hardship, education system differences, as well as things, feelings of isolation and loneliness as well. And so this program, which was led by a number of academics in Monash PIES, what they did was they developed an academic-led student engagement program, which was centered on providing support. And they found that this would be a very unique way to foster connection with international students, because as literature has shown us, one of the main things that seems to be cited for academic success is whether a student feels a sense of belonging or well-being. And so they decided to provide support through three key areas, which were communication, well-being, and social networking. So they created firstly a series of events that were planned for international student engagement. And they decided to make a more welcoming environment. They wanted to create an inclusive campus community with a sense of belonging. And they basically created, they had everything from a full schedule of events that students could take part in, They had online events such as social networking events. They had well-being activities as well. I believe there was one activity where some of the academics actually together with the students cooked their favorite dishes as well. And all of this was just kind of channeling towards the idea to break down barriers and to connect not just across degrees but also across different year levels, to think about bringing together students from different nationalities and to enhance the staff-student bonding as well. One of these activities that were carried out last year actually involved students between the countries of Australia, Malaysia, and Sweden. So we had students all coming together and networking together. And as you can see here, there were a lot of really lovely feelings that the students had about the Monash Pies networking events. They found it insightful, they found it wholesome. It was a chance for them to actually learn about each other, learn about pharmacy, learn about life, student life in a different country, and also a way for them to build networks and build friendships. So it's a way for us to really use, I guess, the situation that COVID-19 had put us in to actually kind of turn it around into a plus point where, okay, so we can't see each other, but you know what? We can use the technologies that we have available and break those boundaries of physical constraints of getting to know each other. So they were able to learn from one another, improve intercultural competence, networking, and this was also a way for them to improve their oral communication skills as well. Another initiative that we actually looked into, and this was really touching on the second theme, which is in exploring collaborative online learning. And this is a new initiative that we're actually trying out, is to look at bringing together students from different institutions, from different international exchange and partner institutions, and bringing them together to actually learn together as well. So at the moment, we have a collaborative effort that is actually looking to pilot a program encouraging intercultural competence and communication and well-being between final year undergraduate students from 3 different countries. So this is going to be a very interesting pilot program where we're actually going to see how we actually incorporate a large cohort online, the different types of workshops we can have, the different types of skills that they can actually learn from each other. So this really touches a little bit on the concepts of students learning with each other, from each other, and about each other as well. So in terms of PIEs and Quo partnerships, so I work together with my counterparts in Monash, Australia, Dr. Betty Exentaris and Dr. Nilushi Karunaratne. And we're always happy to have, any ongoing chats with anyone that's keen to reach out to us and learn more about these initiatives that we have planned. So on the third and final sort of theme that I will talk about, it was about enriching online student experiences. And what I noticed is that because students are generally very good at adapting to differences in technology and are very adept at using social media, there were a lot of instances where we were able to actually get students to lead learning. And one example was where in Monash, Malaysia, we actually created self-directed online interprofessional education modules. So what we did is that we bring together students from the School of Pharmacy and the School of Medicine, and usually it's about 300 students in total, to collaborate virtually in a 2-hour self-directed workshop on cardiovascular and chronic renal disease. And we got a lot of great feedback from this. So what we did was we actually got them to utilize a whole bunch of softwares where they were then using self-directed modules to complete a series of activities to learn more about each other's roles, each other's professions, the strengths in which they can come in and collaborate together and work as a team. They also had to create patient education resources, and they had to answer a series of activities. And overall, what we found is that students actually really enjoyed these activities, and they found learning IPE just as fun online as it could potentially be in person as well. So we had, I think, a response rate of about 92% that found it to be a very useful activity for them, and more than 90% also felt that it was run quite well online too. We also found that actually there were many key instances where students actually used social media to lead awareness on key themes. So this is an example of a medication safety week that was actually run by our students to help educate each other. So they touch on medication safety in year 2 of their pharmacy practice syllabus. And here they start to learn about the differences between, the regulatory environment in Malaysia, and also a little bit on the regulatory environment in Australia. And what they actually then did was that, led by their pharmacy society, they decided to utilize a variety of online methods. So they used online video interviews, they did webinars, they had infographics, they had podcasts on multiple social media platforms. And this was really to help to lead awareness on medication safety, not just for pharmacy students, but also for the campus, and potentially it could also be widened up to the public as well. And we also found that they went a step further and they used the online media and gamification to actually improve understanding of the profession itself. So from exploring, career pathways and opportunities, and what student life could be like after graduation, what, things that they needed to know about workforce readiness through webinars, online Zooms, workshops, and podcasts. They also then went a step further and they decided, hey, let's try gamification. And let's create a whole bunch of online puzzles, friendly competitions, and giveaways where, here the example here you can see is they decided to host something called Multilingual Week. So Malaysia being a melting pot of cultures and races and ethnicities, we have a whole variety of dialects as well that are spoken by our patients. So they took the opportunity to actually teach their cohort and their peers about, common medical terms, ways to ask questions in a variety of dialects like Hokkien, Tamil, Mandarin, Malay. So this is actually a great way for them to really kind of expose and to lead learning in a different way, using and really kind of bringing, all the advantages that one could actually have from their experiences during this COVID-19 pandemic. So that's really some of the examples that I have to share with you from my perspective of how I feel the COVID experience actually helped us in advancing pharmacy education. And what I will do now is that I'll actually pass it on to my co-moderator, Desa, to carry on with this webinar. Thank you.
Thank you, Anissa. Thank you, Son, for the great talk on how COVID has changed us in a way, particularly during pharmacy education. Now let's move on to the second topic on challenges and enablers to pharmaceutical education during COVID. So next, please. We would like to have our third speaker, Ellie Daring Anderson. She's the faculty member of the University of Nebraska College of Pharmacy, and she's also the pharmacist from Lincoln, Nebraska, USA. So the time is yours, Ellie. Thank you.
Thank you. Good morning, good afternoon, good evening. When we think about the challenges, I think that some of them become immediately apparent to us. And we can go to the fabulous literature search that Sean did and provided to us, or we can simply say, what was my lived experience? And I think that what we will probably all decide is that internet connectivity is a challenge, right? Even on something as organized as this program, before we came on the air live to chat with you, we got instructions about, if your internet is slow, do this. And if that doesn't work, do that. And if this doesn't work, then maybe try using your phone or another laptop or whatever. And you can see that there are just some basic challenges. Everybody else seems to figure out how to get their FIP logo so that you can read it. Yeah, but not me, mine's backwards. We knew that skills assessment, particularly when the students needed to do something hands-on, was a challenge. Sometimes you could see it over a video camera from a computer, other times you could not. Student connectivity and connectedness, I think the program right before mine talked very clearly about how they turned that challenge into a success, but that didn't always happen. And in the United States particularly, but worldwide, we had something that we have coined the Great Resignation, and that is traditional healthcare providers quit. They found something else to do because of burnout, because of stress, and sadly, sometimes because of personal or family illness. Next, please. So when we think about the internet connectivity, when we drill down into that, certainly bandwidth became an issue. There were students who could hear but couldn't see. Did we need to have a video, or was audio sufficient? There were places in the world where the price accessing internet actually went up dramatically. And we had a variance between students. We had students who had reasonably affordable access to internet, and other students for whom that was a major part of their budget. Technology knowledge, we joke that tends to be ageist. That is, the students being younger than the faculty dealt with the technology better. But there were always issues, even for those who were the most adept. And then there are people like me who aren't terribly adept. And so not only did I have the technology issue, but I had the embarrassment of having a technology issue. The ability to teach online was an issue for some people, either because they couldn't get to a good projection site, or because they weren't comfortable not getting feedback from their audience. As academics, we know that we do, in fact, respond to immediate student feedback. And right now, frankly, I'm getting none. And that's okay. That's not how this is designed. But I needed to find a way to meet that challenge. Virtual learning versus asynchronous learning. Could we still have deadlines, even though the students had much more control of their own time? How did that work? And then certainly we had some programs who relied on social media for various student organization communication, even some academic communication, only to realize, oh wait, this is social media, and it is not private, and it is not necessarily a great format for hosting a patient case, even if that case were fictitious. Next, please. Skills assessments. What can we do online? We discovered you can, in fact, see all of the markings on a syringe, and you can, in fact, monitor someone giving a vaccine. Interestingly, our accrediting body didn't recognize it as quickly as academia did. So we had to do some negotiation to say, yes, we have met your standard. We just met it in a different way. Interestingly, we also discovered that there are skills that can be assessed by a community partner. That may be a community pharmacy, that may be a hospital, that may be a diagnostician in the town. And that meant, big challenge, as academics, we needed to say, somebody else can do this. Yes, I think I'm awesome, but somebody else can do this. And then there were those skills assessments that simply had to be delayed until we could get students either onto campus or we could get to them physically. Next, please. Student connections is a struggle. I am going to steal a number of ideas from Anisha, but our student organizations lagged. They couldn't have lunch meetings. Well, they could, but it was over Zoom and everybody had to make their own lunch. And one of the joys of going to a lunch meeting is that you don't have to make any decisions. You don't have to do any dishes, and somebody else buys lunch. Student self-esteem suffered. One of the things that we have not yet gotten really good at is saying, that's a great question. I love it that you are participating when we are online, not like we do in the live classroom. And there are students, heck, there are faculty who need to hear frequently, you did that well. Congratulations, today was a success. And simple things like student socialization. All of us in academia know the pain of special student relationships when they go wrong, and how difficult it is to have students who were dating break up or whatever. But we miss the basic socialization of, hey, do you want to come to my place of living to watch the World Cup, for instance, or any of those kinds of things? And those struggled. The students found a way to do some socialization, but that is a remaining challenge for us. Next slide, please. The Great Resignation, we are learning that we need to teach about burnout. And I am thrilled to hear both of the speakers who preceded me talk about that challenge. Illness and the concept of long COVID and all of those circumstances. Right now, in the United States particularly, but worldwide, we are having sort of a triple-demic. We not only still have COVID variant, we have a dramatic increase in respiratory syncytial virus and the highest reporting of influenza in any given week since 1918. So there are people who are tired and people who are sick, in addition to people who are sick and tired. Pharmacy stepped up, and we are proud of that. All of FIP is proud that we gave more vaccinations than any other profession, that we learned to do point of care testing, that we were enabled to give medication for treatment following a positive test, immediately following that positive test. But boy, that's exhausting because it didn't seem like they took anything off our plates. We also had what I think is going to turn out to be a continuing challenge in all of healthcare. And the literature is beginning to grow on the incredible danger of allowing misinformation the same media access as science. Next, please. I started with the challenges because I am really, really excited about the enablers. We discovered we have very creative faculty, and we'd never called on that before. We discovered that community partners do want to be a part of the education system. They may not want to be permanent fixtures in academia, but if you call the local nurse practitioner and say, I have 3 pharmacy students, I need to check them out on listening to heart sounds. Can you help me with that? They are honored. They are thrilled. They are dedicated. Turns out we have really bright students. And we probably ought to spend more time thanking the admissions committee for finding us a group of students who could weather this storm and do it with such grace. Government support, I know when you read that, you thought, well, my government didn't find any money. No, my government didn't find a lot of money either. But what they did find was the ability to say, pharmacy is important to us. And that support mattered. Our creative faculty pivoted. They discovered they were willing to ask for help. They were very empathetic. Next, please. Our community partners were thrilled, and They became great advocates for healthcare and for science. And I think in doing that, we are going to discover that our misinformation challenge is best met with community advocates. Next, please. Our students are smart. They found creative solutions. I was fascinated at some of the projects that Anisha showed us. Next, please. Most of our government support, even the support of pharmacists should be able to fill in the blank, is not permanent, but it's there. And it's actually going to be harder to take away than most folks realize. The government is challenged by misinformation. The voters are challenged by misinformation. But I think the one big enabling piece is that in some countries, for the first time, the government said, we trust that pharmacy and pharmacists will do the right thing. And that's an amazing message. I'm sorry that 1 million people had to die before somebody said that to us, but that's an amazing message. I would be honored to turn this program over to the next presenter, who is going to be very fascinating. I believe we have every reason to be hopeful. We also have a need to document that. So if you haven't written your COVID experience, do that. There are people who want to read it. Thanks.
Thank you, Ellie. Thank you very much for your insight talk on how we face like enabler and also challenges during the COVID. And now I would like to introduce the next speakers, Sevat Malaba. He's currently leading for early career training strategy within the FIP, and he's also the chairperson for Africa YPG and also assistant director at the University of Zimbabwe. And he'll be talking about how we could prepare a future pandemic approaches for pharmaceutical education from the African perspective. So now I would like to give the screen to Separ.
Thank you so much. Good morning, good evening, good afternoon to our listeners. My presentation is on preparedness for future pandemics and approach for pharmaceutical educators from an African perspective. So basically, we're just going to look at what we have learned from this past COVID-19 pandemic and how we can shape and create a future in terms of within the educational sector as pharmacists. So like my earlier colleagues have talked about, Ellie and Sean, they've talked so much information on things that we have learned. There are quite a lot of lessons, like Ali said, we have to document some of those lessons so that they will become very useful as we prepare for future pandemics. And also there are quite a lot of successes and achievements that we actually did right in terms of adapting to this pandemic. We had so much achievements that we actually saw coming through. And also, like Ali just said, we have also had shortcomings, we have challenges. I mean, certain things that we actually faced as we were going through the pandemic. And also, probably the purpose of this presentation is we're talking of what strategies can we implement for us to be better prepared for future pandemics. So on my next slide, I'm just going to just briefly talk about how the COVID-19 pandemic affected the educational sector in an African perspective. So we saw social distancing protocols being put in place, which actually affected to a great extent in terms of the learning activities, as we saw schools being closed because of trying to combat the spread of the virus. I think in my country also, they actually schools are also hotspots in terms of spreading of the disease. That's why that's why they also then had to put measures in place for schools to be temporarily closed. They were trying to introduce technology-based learnings. And in most cases, like most educational institutions, we saw most people, because we're not really prepared for a global pandemic of that of that magnitude. We saw people migrating use of Zoom platforms for learning between students and lecturers, which also had its own problems, as it has been said earlier. And also, we also saw schools closing long periods for learning due to disease outbreaks, which resulted in either temporary or permanent damage on the educational system, because we're not prepared and we didn't know what to do. And it was really quite difficult because there were actually there was actually no plans in terms of trying to migrate into digital learning. According to the UNESCO study that was conducted, UNESCO that was conducted in 2020, it actually saw that about 209 million learners from the African region were actually affected by the pandemic. This also caused some damages in the learning activities. Some people were not even able to cover their curriculum as per schedule because of the pandemic. In some instances they had to close, then they had to open, depending on the environment, as the number of cases of COVID-19 were increasing drastically. In my next slide, I'll also talk about, just show you a distribution of the impact of the COVID-19. As you see that Africa, we had the second highest number of people, learners who were affected by the pandemic. And in my next slide, we just talk about what did we learn from the pandemic. So we actually saw that disaster preparedness is very important. It is something that we really haven't invested much in terms of institutions of learning being prepared for pandemics. We having policies and guidelines on when, in case of a pandemic, what do we do? That was something that was non-existent in most cases. And also so that the educational institutions were actually very behind in terms of e-learning, as we are actually accustomed to our traditional face-to-face learning, which then was disrupted by the pandemic. Also so that we actually didn't have enough infrastructure and resources to be able to conduct research or projects during the pandemic, which was also very challenging to learners. Like I think one of my colleagues talked about this also. I think the cost of internet or the cost of connectivity, that was really quite challenging. As we also saw an increase in the cost of internet during the pandemic, as people were trying to migrate to online learning. We then also saw a drastic increase in the cost of internet, which also actually had a very huge impact in terms of learners being able to, for example, to attend a 2-hour lecture on pharmacology. I think it really had an impact to both learners and educators. And also so that as much as when we didn't have enough infrastructure in place, there was actually lack of necessary competent skills. For example, you talk of your digital literacy, it talks of vaccination. Us as pharmacists, especially because of our policies, public health policies and guidelines which are in place, there was really little emphasis before the pandemic on pharmacists being involved in vaccination. So there was actually a gap that we really needed to be filled, and also in terms of disaster management. So on my next slide, I will then also talk about some of the challenges, as they've been said, some of them have been said earlier by my colleague. We also saw the disruption of the learning activities for quite long periods because of the social distancing protocols, and also because of the increase in the number of cases of COVID-19 that were actually observed. It was also a very huge challenge, especially for the government, to be able to create safe spaces for learning for students. I mean, it really required a lot of investment in terms of infrastructure, and this actually delayed the learning activities as they had to be able to create a safe learning environment. And also we saw delays in examinations and practical assessment being put in place. We were also not able to put in place digital platforms that could be used for administering exams and even practical assessment. Like I said earlier, as one of the huge challenges was the cost of learning, as you saw actually the increase in the cost of internet. And digital literacy was also a problem, both to the educators and to the learners. How do you use a Zoom application? Okay, how do you share a screen? Some of those things, for some of you, it may be easy, but it really had a big impact in terms of facilitation of online learning. And also the ability to conduct research and developing products to those who were doing practicals. It was really a big problem. And also, we actually experienced challenges in terms of remuneration for educators. So mostly because the lack of policies, it was really difficult to say, okay, so how do you pay an educator who is teaching online? What criteria are they going to be used in terms of saying, because our policies before we're just looking at the availability of an educator conducting the lectures, then being recorded as attendance. But now with online learning, it was really difficult. For example, because of in some parts of Africa, we actually had problems with electricity. And if there is no electricity and the educators and they want to conduct lecturers. So are you going to say because of a national crisis that was going on at that moment, they are not supposed to be remunerated, even though it's really something that is beyond their control? And also something that has also been talked in terms of misinformation and disinformation, which was actually challenging in terms of the type of information that was actually being put across on different platforms, especially on social media, which actually had a huge impact in terms of being able to facilitate a safe learning environment during the pandemic. So on my next slide, we also have to talk about some of the achievements. For my country, I think we were actually happy that we saw educators collaborating with the various stakeholders to come up with measures for adapting and adopting the COVID-19 environment that was on hand. So we also saw vaccination training programs being put in place. So actually, to date, we had more than 200 pharmacists, and we've actually been trained for vaccination, which is something that is actually commendable, because our current Bachelor of Pharmacy honors degree didn't have the scope of having pharmacists being involved in vaccination training, but we actually saw something that was actually being done. And we also saw some faculty members actually being involved in manufacturing be it of hand sanitizers by students, and also the formulation of products that could actually be used for sanitation. We also saw is the manufacturing of protective clothing, and also testing equipment and ventilators by other faculty members. That was actually commendable. And also, we actually saw new competent skills actually being developed. I'm glad to be part of the FIP team that was actually involved in the revision of the global competence framework, where we saw introduction of digital literacy, humanitarian response, and interprofessional collaboration. And these competence skills were actually quite useful during the pandemic. And also even for future pandemics, as we have seen, most of my colleagues have talked about digital literacy, they've talked about interprofessional collaboration. And also, we also saw research being conducted, which was actually within African context in terms of, okay, so we're talking of certain types of drugs that are being used in Europe or in the United States, but we don't have access to them. So what can we do? So we actually saw research being conducted on available products on herbal medicine that can actually just alleviate symptoms of COVID-19, which is actually a good work that was actually being done by educators during the pandemic. And also their participation as frontline health workers when needed. So on the next slide, we'll just look at the summary of, from an African perspective. We actually saw that we didn't have enough in terms of preparedness for natural and disaster response, which is something that was actually being worked on at the moment. Being able to have educators working with various stakeholders to be able to put in place protocols, to have clinics at their institutions being prepared for natural disasters and pandemics, which is something that was also not part of their protocols. And also, we also saw that selfishness was actually one of those limitations. As we saw those who had resources, it was actually difficult for them, or the unwillingness of them to share with them, with others, in terms of having resources being allocated for everyone. And we also saw that there was lack of appropriate infrastructure and resources, which is something that actually needs to be worked on in terms of telecommunication, which is actually one of those resources that we really need to invest in for us to be able to facilitate digital learning. And also there was a gap in terms of competence and policy, which is something that is actually being addressed in some institutions. Is FIP has also upgraded their global competence framework and also in the introduction of the other competencies for educators and for learners, so that we can be able to prepare for future pandemics. So thank you so much for listening. Thank you for this.
Thank you, Sepat. Thank you for your experience, like how the African having the experience during the pandemic. And then I would like to invite all of the participants, if you have any questions, please type in on the Q&A box, or you can also type in on the chat box. And to the next one, the last but not least speaker, we will hear about how the experience from Kuwait on preparing for the future pandemics. So I would like to give the floor to Dalal Al-Tawil. She's currently the Vice Dean of Academic and Student Affairs at the College of Pharmacy, Kuwait University. The screen is yours, Dalal. Thank you.
Thank you very much, Desek. Good morning, good afternoon, and good evening, everyone. So thank you to all the speakers. I thoroughly enjoyed your talks. And if I do, since I'm the last speaker, if I do repeat on anything that they've said, it's just basically to emphasize the importance of these points in particular. So I'll be talking about how we can prepare for future pandemics, especially in pharmacy education, but from maybe the Kuwaiti perspective. Next slide, please. Right. So maybe I'll do the same. I'll start by talking, as Shepard said, about past pandemics. And we want to learn from our past, obviously, to plan and inspire our future. So looking at past pandemics, it kind of calms us down because mankind has been through a lot of other epidemics and pandemics in the past. And I've just highlighted here the pandemics mankind's been through in the 20th and 21st century, such as the Spanish flu back in 1918-19, which is very similar to what we went through now in COVID, the Asian flu, the Hong Kong flu, going on to HIV and AIDS in the 80s, and then SARS and swine flu, and brings us to COVID-19 now in 2020. So maybe I'll also pinpoint a view of the epidemics and pandemics in the next slide that we went through. So basically, if you look at cholera in the 19th century, how did they respond? We need to see how people did it in the past so we can prepare as well. And in the past, looking at the cholera pandemic, responses started from basically prayers and people being in quarantine, which is similar to what we did in COVID, but ended in a huge investment in water infrastructure back then, also later on in vaccines. There was also the Ebola epidemic, and with regards to that, the U.S. Barack Obama at that time kind of trained U.S. troops to be deployed in Africa. And I think there were about 300,000 troops that were going to be trained to go assist tackling Ebola. But by the time they got there, the disease had subsided. And then Ebola was actually called the perfect storm by the media. So there was a lot of the media was calling it the perfect storm. This is because as some of the African countries that were hit had already had dysfunctional health services at the time. As a result of decades of war, there was low public trust in the government and in Western medicine. So there were also traditional beliefs and even denials about the existence of the virus, and then also burial practices that involved contact with contagious Ebola-infected corpses. So it was the perfect storm, and it hit hard. And if we look at HIV and AIDS, the epidemic, the media played a huge role in this epidemic. In particular, the media outlets used problematic language, such as, they used to say people who had contracted the disease through blood transfusions were innocent victims. So what does that mean? Is that other people, were they guilty? So I'm just trying to highlight here. One thing that all past pandemics had in common was lots of panic, lots of confusion, uncertainty in the early stages. But that diverted the attention from those that were at significant risk of infection, and it diverted our attention from more important as well things. So if we look, I just wanted to maybe look at the past pandemics, because if we look at them, please, if we can go to the next slide. The two main deterrents in past pandemics, if we learn from the past, is that there were two main deterrents, and it was the infrastructure failure and the problematic language that was being used by the media in particular. So media was scaring people. There was, people were already panicking, and that just increased their panic mode even further. There was also misinformation from many sources. We also saw the misinformation, or let's say people misinterpreting study trials or clinical trials when it came to COVID. And that all instills fear in the general public. So, fear is understandable, and it can help motivate behavior change. However, when fear becomes irrational or leads to panic, it often results in poor decision-making and other unintended consequences. So, next slide, please. Okay, so you see here this picture of an old Kuwaiti sailing boat. So this, we call it in Kuwait, it's called the boom. And I'm going to use this metaphor, and I've borrowed it from some of my colleagues who've actually published a book on a roadmap to improving education in Kuwait following the COVID-19 pandemic, called From Here We Sail. So it basically is a metaphor that our education system is like a boom, a traditional Kuwaiti sailing boat, and we want it to keep sailing no matter what the weather is. Okay, so let's say this boat is the Kuwaiti kind of education sector. So Kuwait, like many countries across the globe, has had its fair share of crises that I will talk more about in our next slide. I like this saying here that I've put on the right side that goes with the Kuwaiti boom metaphor as well. So it says, always plan ahead. If it wasn't raining when it wasn't raining when Noah built the ark. So basically what that means is failing to plan is planning to fail. So in this slide here, you see I've got a picture on the left here of some kids during the Gulf War in 1990. So like I said, the Kuwait's been through its fair share of crises. So the Kuwaiti education sector went through a few crises, and these couple happened in my lifetime. The Gulf War, which is in 1990-91, we went through a 7-month invasion. The picture on the left here shows a family that had tried to keep life as normal as possible for their children. And these little kids were having their normal school routine of waking up. We usually, our government schools raise the flag. There were music lessons, Arabic and English lessons, and they tried to keep their routine. But this was like an individual effort by some families during the Gulf War for kids who were in Kuwait at the time. However, during for the refugees, so any refugees that were outside the country at that time, the government actually funded all schooling for Kuwaiti children. So I was one of the kids who was abroad at that time. We were stuck during a summer holiday, stuck in the UK, and we stayed there for a whole year and went to school there. So the Kuwaiti government funded our schooling, and they even sent, they made sure our language was still there. So they sent us Arabic books to our houses. So obviously the education sector in Kuwait has rebuilt quite well after the Gulf War in 1991. On the right here, you see the burning of the oil wells. So Kuwait, after the war, went through one of the biggest environmental crises in recent history, with the burning of over 700 oil wells right after the Iraqi troops left Kuwait in 1991. So days were pitch black. However, as you see on the picture on the right, schools set up tents as they were still recovering from the war. The schools were damaged, but they actually set up tents, and our parents had to go there and register us for schools because they were aiming to start in September. The war ended in February, but they still had the vision that schools would start in September. They would reopen. So if we go to the next slide, please. So I just wanted to show that, we have been through crises before, but then when COVID hit, so this brings us to our most recent crisis. The education sector in Kuwait, like everywhere else in the world, at first thought it was just dealing with the tip of the iceberg. So they thought they were dealing with just COVID. They made sure initially priority was on masking students, keeping our distances. However, later we realized it was more than just that. We had to struggle to think of, how are we going to finish? Like Shepard said, some people couldn't finish the actual curriculum, the annual curriculum they had to finish. How we were going to manage to get the material to the students. We had to manage student and teacher training for virtual learning. We had to make sure we were, evaluating our teaching. How are we going to evaluate our teaching? Our visions had to be modified. So preparedness of different countries was different depending on what they went through in the past. So a study I looked at showed that while epidemics are more common among poorest countries, there nevertheless appears to be no appropriate preparation for a larger scale pandemic such as COVID among countries, regardless of their level of development. So next slide, please. Okay. So I looked here on the impact of COVID-19, and I think FIP has done an amazing job at having so many webinars on COVID and talking about the impact of it on pharmacy education. But looking at it globally, so we all know a lot of schools closed. COVID was a global health emergency of unprecedented scale, and it presented unique challenges that we were very unprepared to address. Schools closed, a lot of students were pushed out of school, had to attend virtually, and many forms of distant types of education were delivered. But then evaluation, I think only 30% or fewer, a study shows, of countries reported that they are monitoring the take-up of distance education. So looking at that was globally. Looking at Kuwait and highlighting the Kuwaiti perspective, our education sector actually halted for 6 months. We were, I have to admit, unprepared to transition to online learning. Parents were divided. So we're talking here about the media. The media scared everyone. Parents were divided as to whether to send their children back to school or to university. And decisions were mainly left in the hands of the Minister of Health. So the Minister of Education wasn't actually taking on the major decisions, as it was a healthcare crisis. A lot of the decisions were just left with the Minister of Health. So if you go to the next slide, please. So this brings us back to the two main deterrents that we saw in the past and the other slide. So we need to kind of look at them again. We need to strengthen, I think, our infrastructure and also improve our communication. Make sure that what messages we are being sent out do not instill the panic and the confusion that was either in our students or in their parents as well, or in staff in general. Okay, next slide, please. Okay. So we talked about strengthening our infrastructure. We have a saying now that we always say in education. It's that education should be the last to stop if we go through crisis, and it should be the first to restart. The urge to apply a one-size-fits-all approach should be resisted. We need to think of our minority as well groups. We need to think about our special needs, let's say students. How are we going to adapt education to them? We are likely going to face more health crises in the future. So we must prioritize strengthening the resilience of our education systems to make sure, our students' learning isn't harmed. So I think it's very important to call for an investment to improve the resiliency of national education systems. We need, I think, in Kuwait especially, to develop a stable online education infrastructure. We need to scale up distance learning, incorporate aspects into everyday schooling for all students and at all levels. So now that the pandemic is over, we shouldn't just stop, for example, training our students on the use of these virtual technologies and virtual ways of learning. Countries need to build capacity to deliver quality education remotely. And we need to target those vulnerable and marginalized students who are often forgotten. Next slide, please. So in order to prevent, and one of the targets is to improve communication. So to prevent misinformation, an official speaker should be nominated to communicate with students and staff. So we need to have a crisis management team. We also need to have, I think Ali and Sean mentioned this, a very strong social and mental health support to students and staff going through these crises. So a study published in the Educational Researcher, a peer-reviewed journal of the American Educational Research Association, just recently in November 2022, showed that teachers experienced significantly more anxiety than even healthcare workers during the pandemic. Those teaching remotely reported substantially higher rates of depression and feelings of isolation than those teaching in person. So can you imagine if teachers themselves went through that? What were our students going through in terms of anxiety and mental health? COVID has normalized the use of virtual technologies. And like I said, we need to incorporate this in our normal day-to-day teaching. However, not everyone is confident using it. Ali mentioned that. So we need to nominate champions who can provide support to staff and students. And again, I'm emphasizing, I think what Ali and Sean and Anisha said, is that we should not feel we are not alone. We need to collaborate with either community collaborations or multidisciplinary collaborations and partnerships. And it's important, again, like Ali said, to document our what we went through. And we actually, a group of us academics at Kuwait University documented what our perspectives during the COVID-19, and I have the reference on the last slide. So if we go to the next slide, please. So in summary, again, using my the Kuwaiti boom or the Kuwaiti sailing bowl metaphor, I think what we need to work on here is strengthening our infrastructure. We must continue to scale up distance learning and incorporate aspects into our everyday schooling for all students at all levels. I think one of the main barriers that we faced, we were transitioning to a new program during COVID in 2020, and it's a competency-based program. So we were thinking, how are we going to be assessing these competencies through virtual schooling? We need to build on lessons learned from university closures and create comprehensive preparedness plans and develop strong national infrastructure to deliver education through different modalities and monitor its reach and contribution to learning. Make sure it's a continuous kind of evaluation process. Develop communication channels, like I said, make sure the information, the correct information is being provided to our students and to our staff, as well as providing mental and social support. I think what we're doing now is great through 1FIP. We need this initiative that aims to train pharmacy educators from around the world with a standard set of pandemic response skills, and creating a global network is amazing so that we can collaborate on outbreak, how to react to outbreaks and how to control it from the pharmacy education perspective. Thank you very much. And my final slide has my references with the multidisciplinary academic perspective from Kuwait being my 5th reference there. Thank you very much.
Thank you so much, Dalal, for your talk on how Kuwait has suffered from the COVID, and also how you can think about the future preparedness in dealing with the future pandemics. So is there any questions from the audience here? I think we have one question within the Q&A box. So shall we start reading this? The first one is from Laitu Rahmi from Indonesia, and she's asking to Ali. After 2 years of remote learning, we noticed that some students could not demonstrate expected skill and attitude despite of being the 2nd year or 3rd year pharmacy student. What do you think the strategy can be used to catch up with these skills or attitude? And you also have their own student workload, while they also have their own student workload this semester. So can you please, Ali, answer this question?
Well, I will do my best, which is offer some options. I don't know that we have a best practices defined, but we do know that students tend to model those people who have the most impact on their education, and that's not necessarily the person who gives them the most data. It is the person that they believe cares about them the most. So I could recommend identifying those role models, particularly for professional attitude and professionalism, and set up a mini mentorship circumstance where the student has that person who can say, I don't think that that was the appropriate response or the appropriate attitude. Let's consider these options. The student won't find that terribly threatening because we've already identified it as someone who is respected and that the students trust. As far as the skills, I cannot overstate how important our community colleagues were. And that's not just people in a drugstore, that's people who are near our students who can say, we have been told that you're having a challenge with pick a skill. Let me show you how I do it. Let's practice together. And I understand that that will take some student time, but not as much as you expect. With most skills-based challenges, there's one key point that they're missing. And when you can find that community person who's really good at it, it doesn't take them long to identify the missing piece. If you need somebody to learn to vaccinate, I will take them. If you need somebody to learn to evaluate breath sounds, I know who I should refer them to, because that's not my talent. But folks who we would consider adjunct or community partners are really, really willing to help when we start the conversation with, you are a recognized expert and we would like your input. Though that's my best advice.
Thank you, Ali, for that. I hope it's answering your question. I would like to also invite probably Son or Anissa or even Sevad or Dalal will be able to share probably some of their experience in order to cope with this. Son, Anissa, Sevad, or Dalal? Like, because Ali mentioned like having a role model or mentorship will be beneficial to get the experience from those the students who was impacted by COVID. So Son, do you have any comment on that?
Yeah, I think Ali touched on a lot of great ways. Some other things that you can do is some of it won't address all of the expected skills and attitudes, but some of them, simulation software has done a great job, especially with communication type skills, if those are areas where they're missing out. I'm trying to think of, as far as the more hands-on things, I would defer to the way that Ali did them and access with our professionals and those that have the most experience. But the simulated software is really quite amazing. So that would be something I would point toward.
Okay, thank you, Son. Probably I would like to ask, because I haven't got any more question within the Q&A box. From your reading on the Leeds review about sharing and caring and preparing for the pandemic, is there any case studies or studies in the literature, like big studies, which have report about this?
Yeah, within that scoping review by Courtney et al., there was a really nice table that had, all sorts of summaries, and there were case studies within there that did get to that. I'm blanking on specifics, but I know within that scoping review, they were all divided by different categories, and that was one of them, was the well-being one.
Okay, thank you for that, Son.
Mm-hmm.
So I think I would like to hand over to Anissa for the next session.
Thanks very much, Desak. So firstly, I would like to thank everybody for attending this event, our audience that was with us from the start. And I'd also like to thank all our panelists for their fantastic insight. We've learned a lot from you today. And I'd also like to thank our hosts. I'd like to thank Desak. I'd like to thank our FIP host, Ali, as well, for running this session very smoothly. I would like to actually bring your attention to this URL here, so events.fip.org. So you will be able to catch our recordings, as well as of all the other FIP digital events that we have had from this link, also from our YouTube channel. And for all information on future FIP digital events, you can also go to this link here and to register for these events. So I guess before concluding, I think we have actually learned so much today. We've had a chance to discuss a lot today. We've learned a lot about, firstly, literature review from Sean in terms of what we have come to learn and how we have advanced our pharmacy education since the pandemic. I provided some examples on how we are looking at aspects such as mental health, on enriching our student online experiences, on creating more student engagement. We got to learn a lot about challenges and enablers from Ali. That was a very interesting session there, which was then built on further with an African perspective from Shepard. And finally, from Dalal, we got a very holistic also perspective of how COVID-19 has impacted pharmacy education in Kuwait. So I hope this was a very informative talk for you. And again, if you wish to go through the recording, you can go through the recording from the events.fip.org website. So thank you all, everyone. Thanks for starting your day, having your lunch break with us, or ending your day with us. And I'll hand it over to, I believe, Ali for if there's any FIP announcements. If not, we'll call it a day here. Thank you.
Thank you, everyone.
There won't be any further announcements. Thank you so much.
Thank you.